Concussion is a mild form of traumatic brain injury that occurs after any kind of jolt or blow to the head, which is often seen in an athletic population. It can occur during sports, but it can occur to anybody that's even fallen and hit their head. Anybody that's sustained any kind of impact to the head or blow or jolt should be evaluated for a concussion. Symptoms can be minor as just having a headache and feeling a little bit foggy, or having more severe symptoms such as memory, concentration problems, nausea and vomiting, decreased balance and coordination. They might forget where they are on the field, what opponent they're playing, score of the game, and things like that. If you're an athlete, you need to be removed from play, and that's the first and foremost thing, because second hit syndrome can be dangerous and deadly, where you get a second concussion on top of the first concussion. But anybody that suspects a concussion should be evaluated by a doctor, and coaches as well should be trained in on-field assessment, and parents as well should know what to look for in athletes. Anytime symptoms linger longer than 48 hours, it's considered a post-concussive syndrome. And that's where we come into play at the Rehabilitation Center. We work with people that have had concussions and helping them get back to normal before they go back out onto the field. What we do over at the Rehab Center is we go through 5 phases of rehab. During the first phase, you're only at 30 to 40%, for example, of your target heart rate, and you're not doing any impact activities, so no jumping and things like that. And then we just gradually reintroduce those activities as we monitor symptoms, as we monitor vitals, and ensure that the athlete is healthy and ready to return to play and not at further risk for something like second hit syndrome. So as an athlete, I've been sidelined from play before from injury myself, and I know how aggravating it can be to sit on the sideline, but I also know as a physical therapist how important it is to get back to play safely, and that's part of our job over at the Rehabilitation Center, is just returning athletes safely to sport, or anybody safely back to the activities that they want to do.